So if you have a headache or a migraine and you come into my office and you probably think, oh, well, she doesn't know what I'm talking about. But I do, because I have migraines as well. So does my husband. So we deal with it on a daily basis, and we continue to function well, and we have tailored our lifestyle to help us with migraines and medications, and so can you. So there are some things that you can do at home to help with migraines, and that's kind of just like a personal hygiene. Migraine hygiene. So one is the most important thing is sleep. So you maintain sleep, go to bed at the same time, wake up at the same time. Exercise about 30 minutes every day. You try and watch your diet, keep an electronic journal or a daily journal. Make sure that you write down what was different you did that day, so you know your triggers. Weather is another trigger. So if it's hot, humid, or cloudy outside, you want to make sure that you're well prepared for it. You want to make sure you hydrate, stay out of direct sunlight, wear big floppy hats when you're outside, and you want to make sure you drink at least 7 glasses of water a day. You want to make sure that you don't excessively use over-the-counter headache medications, which could be Excedrin, ibuprofen, Tylenol. It shouldn't be more than 10 days a month, because that can produce a chronic headache. And then we're dealing with 2 headaches, a chronic headache and a migraine headache. So those are just some basic tips. Certain triggers can be smoke, odors like strong perfumes, dairy products, caffeine, chocolate, nuts. Those are things to generally look out for. Any kind of artificial sweeteners or preservatives in foods. You want to make sure that you're cutting all of those out. So please note that there's several options for treating migraine, both for abortive therapy, which means things that you can take at the onset of a migraine, and then also there's prophylaxis, which means that you take a daily medication to prevent the migraines from coming on. We tailor your medication regimen according to the type of migraine you're having, the frequency of the migraines you're having. So for example, if somebody is having 15 or more, they fall into the chronic migraine category, and if they've been suffering for several years and haven't responded well to any other medication, then we try other options such as Botox. Most people think of Botox as a cosmetic procedure, whereas it's been around for migraines for several years now, and we have several patients who do wonderfully and are migraine-free on Botox. So do look into that as a treatment option, again with your family physician, who can recommend you to your local neurologist.